Hi, I'm Dr. Scholz. Let's talk about men's health. We've been covering prostate cancer now in an extended series, and it's probably becoming clear now that prostate cancer is more like a chronic condition than an actual cancer. Many serious cancers can be deadly within months of diagnosis. I was seeing a new patient yesterday with a teal stage prostate cancer, a 60-year-old man, and he was quite nervous about his diagnosis, and we'd gone through a lot of different issues, and he said, "Bottom line, Dr. Scholz, what's my chance of dying?" And I said, "I estimate the risk of mortality for his teal stage prostate cancer of maybe 1% at 10 years. He practically fell out of his chair. He thought that he was facing an imminent mortality with his prostate cancer. And that's really the root basis of this discussion today, talking about the annual physical exam, which takes on added importance if you're going to live a long time. What a shame to beat prostate cancer and end up succumbing to some other condition that was preventable. I find patients are often confused about what an annual physical exam consists of. They talk about a panel of blood tests like it's a standardized format, and it's not. It may simply be a couple of tests of your liver and kidneys, or it may be a much more extensive test that covers vitamins and function of your red count. And we're going to post an actual list of the types of blood tests that should be included in your annual physical so that you can do a checklist and find out if all the important things are being covered. But apart from those components, the blood tests and a urine test that all should be done once a year, there's some other things that should be looked into to make sure that a preventable illness doesn't cause you to die of something that you could have fixed. So let me quickly list some of the things that we check in our patients to make sure that they don't die of heart disease or a preventable cancer. First, a CT scan for coronary artery calcium score. This is a 3-minute scan, doesn't involve any injections or IVs, and they can monitor whether there's plaque forming on the coronary arteries. Doctors can use this information to decide if you need a cholesterol pill, whether you need any interventions to prevent heart disease. I recommend this every 5 to 7 years in our patients. What about smokers? Men who smoke tobacco are obviously at risk of lung cancer. If lung cancer is diagnosed after it spreads, there's really no way to cure it. But the CT scans of the chest done on an annual basis in smokers can detect lung cancers at a curable stage when they're small nodules. Everyone who smokes, if you have a family member who smokes, needs to be encouraged to get a CT scan of the lungs once a year. Colon cancer is another preventable cause. Historically, people have undergone scopes every 10 years. There is a new test out now called Cologuard, a stool test that can be done every 3 years, which can detect colon cancer as well, and that's a far easier test than going through a whole scoping procedure. A subject that's come up in our prostate cancer patients who go on hormone therapy is loss of calcium from the bones, called osteoporosis. And if that becomes notable, people can develop hip fractures, and those are preventable with a variety of different medications. A simple scan, once again, of the hip with either a Dexa scan or a QCT can detect this at an early stage. The problem with these things that we're describing is that they all tend to be free of symptoms until something is broken or something is irreversible. This is the point of the annual physical exam, to screen for preventable things when everything seems fine, to make sure that something doesn't sneak up on you. 2 last things that I want to mention. One is a new vaccination for shingles. Shingles will occur in 1 out of 3 of us during our lifetimes. It's a nasty condition, but what people don't know is that about 10% of the time, it never goes away. You can be left with lifelong pain, and this is preventable with a new vaccine called Shingrix. It's a 2-part vaccine. You can pick it up at the pharmacy. Just go in and say, "I want a vaccine." You don't even need a prescription from your doctor. The last thing that can be overlooked is an annual eye examination. People who wear glasses or contacts are forced into doing this, and that's great. But those of us that aren't seeing an eye doctor regularly still need to go in for an annual visit. Why? A condition called glaucoma, which is a silent increase in ocular pressure that, if it goes undetected, can cause irreversible loss of vision without you knowing it's occurring. So everyone should get an annual eye check, whether you're seeing the doctor for eyeglasses or contacts or not. One last thing that shouldn't be overlooked during the annual physical is to have the physician check your skin. Look on the soles of your feet, look on your back. You could even ask your family members to do this. Especially here in Southern California, where we get a lot of sun exposure, dark pigmented lesions need to be vigilantly watched and possibly biopsied. The concern, of course, is melanoma. Melanoma is not that common, but if it spreads, we don't have any way to cure it. It can be cured if it's detected at an early stage. So this summarizes what we consider the annual physical exam, which is important for our prostate cancer patients because they're going to live a long time. We did a whole webinar that went into greater detail that is posted on our YouTube channel if you want to look into this further. Thanks for watching. Subscribe to our YouTube channel for more of these videos and visit our website, which has a wealth of information about prostate cancer.